Regardless of your political views, your educational status, your financial background, or your personal views, I think we can all agree that the nurse is one of the most essential components of the healthcare team in the care of a patient in a healthcare facility. Shouldn't we get paid as such? I want to persuade nurses worldwide to step up, to be bold, and to ask for higher pay in 2022. Negotiating for higher pay as a nurse shows your employer that you are confident in your nursing ability and your experience. The nursing career right now is experiencing staffing shortages worldwide after the COVID-19 pandemic. Nurses now, more than ever, are experiencing burnout, which is leading them to either leave bedside or the healthcare field altogether. Now that I've discussed my topic, I want to move on to explaining my reasoning behind why I think, as a nurse myself, we should be negotiating with employers. Before getting into specifics, I want to discuss the act of negotiating. Being bold enough to ask for more money during an interview shows employers that you are skilled and confident enough to ask for the pay you deserve. The average bedside RN makes $69,224 a year, according to the Nursing Salary Research Report that Nurse.com released in 2018. According to an author from the Harvard Business Review, the typical negotiation is for 15% of the offered salary. So if a nurse in the United States is making $69,224 a year, and an increase of 15% would mean making close to $80,000 a year. That's almost an increase of $10,000. Asking for this small increase in salary proves to employers that you are competent in your nursing skills, you know your stuff, and you are confident enough to ask for the pay you deserve. When done properly, it shows that you're able to communicate professionally, which is another great quality to prove you deserve that pay increase. Now that we've briefly discussed the basics of wage negotiation, I want to talk about negotiation in regards to the current healthcare field. COVID-19 has drastically and negatively affected staffing worldwide when it comes to healthcare, specifically nursing. Basic supply and demand tells us that with increased patients due to the pandemic, more nurses are needed. Also, nurses aren't immune to the virus either. So as expected, many nurses got COVID as well, myself included. This created even more of a shortage that we as nurses are already in. An article called Staffing Levels and COVID-19 Cases and Outbreaks in the United States Nursing Homes states, as the pandemic continues and best practices emerge, the role of staffing is likely to take on increased importance. Implementing efforts to stem transmission is difficult without sufficient staffing levels. Now that we've discussed the effects of COVID-19 on nurses and the field, now I'd like to talk specifics. Because of already short staffing, nurses are being overworked and are experiencing burnout. This is causing them to leave bedside or to work in other areas of the field or leave the field altogether. Nursing is a difficult career to begin with. It is hard emotionally, physically, and financially when not being adequately compensated for the toll that this career takes on a person and a body. The pandemic created especially challenging conditions for nurses worldwide, including being short-staffed, lack of proper PPE, heavy workloads, and fear of contracting the virus, says Johnson & Johnson in their article, Why 2020 Will Forever Be the Year of the Nurse. This simple statement explains exactly why nurses are leaving bedside due to burnout. The author of Hear Us Out campaign reports nurses' COVID-19 reality, reveals in her 2021 article that 92% of nurses surveyed said they believe the pandemic has depleted nurses at their hospital, and as a result, they said that their careers will be shorter than they intended. 66% feel that their nursing career experiences during the pandemic have caused them to consider leaving nursing. Now that I've discussed these things in regards to staffing issues in the healthcare field, I want to review and then conclude. New nurses and seasoned nurses around the world have the ability, the leverage, and the courage to ask for higher wages this year and in the coming years as well. It never, ever hurts to ask for that wage increase. It shows employers good qualities about yourself and your competence as a nurse. COVID-19 has drastically affected nursing staffing and continues to do so. Burnout caused by the pandemic and the career itself continues to cause burnout in nurses, leading to continued staffing shortages. I think that negotiating for higher pay is not going to solve this worldwide problem, but I do think it will help retain the good nurses that are still left in the field.